Should you go to therapy? Let's talk. It's an important question to ask yourself whether or not you should go to therapy, and I think there's three things you can consider. The first one is, do you have a problem that persists and just continues, like anxiety, depression, OCD? Doesn't matter what it is, but something that just continues to persist and will not go away. A lot of people, and I've dealt with a lot of clients, they're going to therapy for the first time who've had anxiety for 20, 30 years, and they've just decided not to do anything about it. Or they've just tried to will their way out of it, or what have you. When you have a problem that goes on and on and on like that, I think therapy is a viable option. Or if it's impacting relationships you have, be it platonic, romantic, doesn't matter. If it's affecting relationships, you really ought to consider going to therapy. If you have one of these issues, or any issue that you're struggling with, and it doesn't matter how hard you try, you just can't overcome it, that might be a good indicator you want to see a therapist and see what they can do to help you out. Will is a wonderful thing, and discipline and all is a wonderful thing, but sometimes you need a little guidance in how to actually attack a problem. And that's part of what we therapists do. Or if you discover that maybe you can deal with it at the moment or overcome it at the moment, but it just keeps coming back and it just continues to plague you, then it might be time to get into therapy. One of the important things about therapy, when done properly, is you get to the root cause of the problem. And in many cases, once you get to the root cause, then you can work it out and eliminate the problem altogether, as opposed to having to cope with it as it comes along. So these are just a couple of ideas for things to look at when you're considering whether or not to go to therapy. Thanks, and I hope you have a wonderful day.